Today on TimesCast, David Leonhardt answers reader questions about expanding the social safety net. New guidelines say the best way to survive is to stay inside.
The key to survival is adequate shelter.
And 50 years later, eyewitness accounts from the deadly day in Brooklyn.
Downtown Brooklyn, indeed, is a holocaust.
David Leonhardt's Wednesday column looks back at the decades-long debate over expanding the social safety net. On TimesCast, he addresses some reader questions.
Our first question comes from Lexington, Kentucky. The merits and demerits of the healthcare law notwithstanding, what is wrong with socialized medicine if it can be made to work? I think there are two answers to that. On the one hand, there's nothing wrong with socialized medicine. It works very well in other countries where everyone is covered, where costs are much lower than they are in the United States. And it works very well in Medicare. Medicare, as Ronald Reagan said, is socialized medicine. But we Americans tend to be much more comfortable with market competition. We think it brings better service. We think it holds costs down in many cases. And so there are systems that are not socialized medicine, but that do have universal coverage and have much lower costs than we do. Those systems are in many ways the model for the United States. Holland, Switzerland. So they have competition, but it's tightly regulated. Our second question comes from New York. How many of those other rich countries, and this would be the other rich countries that all have universal health care, have a military defending most of the rest of the world? The answer is none. The United States has by far the largest military in the world with by far the most commitments. A lot of people think we can make cuts to that military. The deficit commissions that have issued reports tend to include some specifics on big cuts to the military. But I don't think it's simply a matter of if only we didn't have the military, we could afford health care. The main reason we can't afford universal health insurance is that our healthcare system itself is so inefficient. It costs almost twice as much as any other healthcare system in the world. And so I think the main way to be able to afford universal coverage in this country is to bring down costs within the health system. Our final question is a nice short one. It comes from San Diego. Liberty versus tyranny, which should I choose? Well, obviously you should choose liberty. I think the one thing to keep in mind is that the choice isn't always so simple, right? If we think about, do you want to pay taxes in order to afford police? Well, the taxes seem like tyranny, right? You're having to give up some of your own money. The idea that you can go out into the street and feel safe feels like liberty. And I think there is an analogy here with healthcare, which is that having to pay taxes in order to get health benefits in some ways feels like tyranny. But being able to know that no matter what job you have, or even if you don't have a job, you will be able to afford health care. You'll be able to get needed care for yourself and for your family. That allows you to take risks that you might not otherwise take. And in some ways, that then leads to more freedom.
Let's examine what happens when a nuclear weapon is exploded near the Earth.
Nuclear preparedness is nothing new, but a story in Thursday's Times reports the federal government is quietly encouraging new guidelines.
Bill, when you and I were young in grammar school, there was a lot of concern about nuclear war. We learned to duck and cover and hide in fallout shelters, and for a long time that has been off the table. It's been unthinkable that something like that could happen. You have a story about how the government is starting to consider this problem of a nuclear explosion again and what to do about it.
Right. They're not broadcasting it loudly like they did back in the bad old days of the Cold War, but they're stepping up to the issue, they're studying it a lot, and they're starting to address it, both with emergency planners and in public. And the counterintuitive advice is don't run for your life, but like duck and cover, seek shelter. So they've detailed this over and over in lots of different ways. It's not being broadcast right and left. The gist of the story is that they're starting to address it with emergency planners, they're starting to put it up on public websites. It's sort of an initiative they're going after gingerly.
And this is based on some new science.
Lots of new science. Congress was worried that this wasn't being taken seriously. Back in the Bush administration, they put some millions of dollars into it, and a strong scientific consensus and a lot of interesting findings came out saying that simple sheltering can save hundreds of thousands of lives.
Is the relatively quiet way they're doing it because they don't want to alarm people?
Yes, that, and also it's just a political, no-win situation, right? I mean, they have critics who say, given what you now understand, you have an obligation to make this message more forcefully.
And all this week, City Room is remembering the tragic anniversary of the Park Slope plane crash. In 1960, it was the worst air disaster to date, with scores of witnesses on the ground.
We're talking to you from the scene of the plane crash in Brooklyn. At the corner of 7th Avenue and Sterling Place.
I was covering an annual event at Macy's when somebody came rushing in and said, "Call your office, it's urgent." I got a phone and the office said, "You better get the hell out to Brooklyn."
The police are running around here, trying to assemble some order. Firemen are running in and out of buildings, as other firemen lighters are pouring tons and tons of water into the burning structure.
It just so happened this day that we had French class in the science lab.
The buzzer went off on the door, and I walked to the front to meet the mailman. As we were talking, the plane crashed.
We just sat there and started to pray and held hands.
And I remember the windows and all the pipettes and all the glass, everything in the lab shook.
I heard my wife upstairs. She was screaming. She was washing her hair.
Everybody ended up, the entire school ended up in the gymnasium.
My daughter, she was 18 months old. That morning, she decided to sit under the kitchen table, which was in the middle of the building. And that's the only thing that saved her, too.
People were stunned. They were just looking blank.
I approached a fire chief, I think a battalion fire chief, and said, "Anyone alive?" And he shook his head.
It certainly is a major disaster. At the corner of 7th Avenue and Sterling Place is a tree. The tree is almost foreshadowed by the thick, billowing, choking smoke, which is so much in evidence here in the area. Downtown Brooklyn, indeed, is a holocaust.
Join us again tomorrow for TimesCast.